A pediatric patient is defined as one between the age of 0 and 18 years old. These patients are usually not yet skeletally mature, which requires that some radiographic procedures be performed differently.
Main points to consider during pediatric imaging are communication, immobilization, and common procedures. We will demonstrate and explain how to properly perform a routine exam to achieve quality patient care.
By the end of this video, you'll be able to understand and explain the usage of immobilization devices and how they are effective, recognize appropriate technical factors used in pediatric departments, distinguish the different communication skills necessary when handling pediatric patients and their caregiver, and what to consider for common pediatric procedures.
With PEDS patients, it is important to communicate with them differently than you would communicate with an adult. Children are often intimidated by being in the hospital, so you want to reassure them and keep them calm in order to get the best possible images. Something to consider when you are communicating with your pediatric patient is that they are usually much smaller than an adult patient would be. It is best to speak at the patient's eye level and make eye contact as you speak with them. You want to be encouraging and positive.
Chloe? Hello. My name is Connor. We're going to be taking your x-ray today.
Okay.
Go.
Hey, how are you doing today?
I'm good. I went to the zoo today.
Really? What's your favorite animal?
Probably an elephant. They're really cool.
I like elephants too. Did you get to see one today?
Yes, I did. I saw so many animals.
Wow, I bet that was a lot of fun.
It really was. My grandma took me.
Oh, really?
Mm-hmm.
Finally, once the procedure is done, give a sticker to the patient and tell them they did a good job. Go.
Are we done?
Yeah, you did a great job.
Yay.
Here, you want a sticker?
Yes.
Yeah, this is a sticker for you because you did such a great job.
Wait, I love it.
Pediatric imaging can be scary for the parent or caregiver as well, especially in fluoroscopy procedures. To ease their worries, you should be able to explain the procedure in simple, easy to understand terms. Assure the caregiver that this procedure will be beneficial to the child and answer any questions they may have about it. It will go more smoothly if everyone is calm and knows what to expect.
So what exactly are you going to be doing to Chloe?
We're going to be taking an abdomen x-ray of her today. So I'm going to be using this is my big camera right here. It's going to take a picture of your belly, okay?
Okay.
Do you have any other questions?
Isn't that dangerous? It's an x-ray.
Yeah, there's small doses of radiation, but nothing over what you normally receive from background radiation.
Okay. I think that Chloe might get a little bit scared being in the room alone though.
Okay, that's fine. We can give you a lead apron to put on, and you can stay in the room with her during the exam.
Okay, that'll be great.
Is there any chance that you're pregnant?
Of course not. Chloe is enough trouble.
Another thing to consider when working with pediatric patients is the differences among age groups. For newborns to about a year old, they typically won't have problems with immobilization. Between ages 2 and 3, you may need assistance holding the patient still, in which case someone could be in the room with a lead apron. You will often be communicating mostly with the caregiver at these ages. For ages 4 and above, when you can converse with the patient, make sure you explain everything clearly and follow the considerations from earlier.
Next, we will discuss immobilization devices and how they are effective. One of the most common immobilization devices used in the pediatric department is the octostop. The octostop is typically composed of wood, plastic, head cushions, and Velcro straps. If small enough, the pediatric patient is placed in the octostop and Velcroed into position. This allows for the technologist to acquire a more diagnostic image because the patient's movement is limited, decreasing motion on the radiograph. Sandbags and Velcro strips are also sometimes used to assist the patient in remaining still. However, you must be considerate when utilizing these tools and, as mentioned earlier, explaining to the patient what you are doing and that they will remain safe. Another common device utilized in pediatrics is the pigostat. This is commonly used for chest x-rays. The patient is placed in a tube-like structure to remain still for imaging. Immobilization devices are important because they limit the patient's movement, thus reducing motion, and therefore providing a more quality image while decreasing patient exposure. In the next clip, we will demonstrate how to properly use a makeshift octostop.
All right, I need you to hold your arm still for this picture, okay? So,
his arms still, but we need them out of the way for the picture. So we're going to use this octo-stop and use this Velcro to keep his arms down. Can you put your arms by your side for me, buddy? Good. No. Keep them down. Now they'll be out of the way for when we take the image so we can get the best quality diagnostic picture.
Another thing to consider when thinking about immobilization tools and how to properly shield is having a caregiver or assisting technologist in the examination room with a lead apron. Oftentimes, a tech or parent must stay in the room with a lead apron on in order to hold the patient still or get their attention. To reduce their radiation level and to remain safe, they must wear a lead shield.
Can you keep your leg still for the x-ray? Can you keep it still? Okay, so he won't keep his legs still. So if there's no immobilization device, what I may need to do is stay in the room with a lead apron and hold his legs still so we can get the picture and so there's no movement. And I need to wear this lead apron, otherwise I might get unnecessary exposure and you want to be as safe as possible. So keep that still.
Additionally, pediatric imaging units have specific techniques set for pediatric patients. The technologist must use a lower KVP and mass because pediatric patients are smaller than adults and you do not need as much technique to penetrate the part. Attempting to use PA views instead of AP will also reduce exposure to breast tissue, gonads, eyes, and the thyroid. Shielding, specifically the gonads, is extremely important when possible on pediatric patients to prevent unnecessary radiation and to abide by the ALARA guidelines. Finally, it is extremely important to note that these devices are used to immobilize, not restrain, the patient in order to get a quality diagnostic image. These techniques will reduce patient exposure and tech exposure and produce better radiographs.
The most common pediatric x-ray order is the chest x-ray. Communication is vital to get the patient to hold still and make sure that the appropriate breathing techniques are used to obtain a quality image. Immobilization or parent assistant is often used to help the exam go smoothly. Be sure to use a proper collimation and technique to reduce patient exposure. Another common exam for pediatric x-ray is the skeletal survey. The American College of Radiology defines a skeletal survey as a systematically performed series of radiographic images that encompasses the entire skeleton or those anatomic regions appropriate for the clinical indications. This procedure is often performed when child abuse is suspected. Child abuse has been described as the involvement of physical injury, sexual abuse, or deprivation of nutrition, care, or affection in circumstances which indicate that injury or deprivation may not be accidental or may have occurred through neglect. It is mandatory in all states and provinces in North America for healthcare professionals to report suspected cases of abuse or neglect. Radiographers report these suspicions to their radiologist. Pediatric patients commonly get fluoroscopic genitourinary and gastrointestinal procedures. The common studies are VCUGs and upper GI procedures. These require contrast media administration to visualize soft tissue structures. Pediatric considerations for performing fluoroscopic contrast procedures include using low osmolality contrast agents to reduce risk of adverse side effects. Also, parents will need to be fully informed about the risks and benefits of the study and what the necessary steps to follow both prior to and post-examination. Oftentimes, the patient will need to be held in place by immobilization devices or be assisted by a parent or technologist in order for the fluoroscopic procedure to operate smoothly.
Thank you
for watching
Our presentation